Biden faces hard truths of the pandemic ahead of major speech that includes getting more people who are unvaccinated vaccinated. That means reducing hospitalizations. That means putting in place more testing requirements and putting in place more protections in the form of boosters to make sure people have an even greater level of protection, she said. Given the political sensitivities, he may not be quite so blunt as emergency room Dr. Megan Ranney, who offered an unvarnished diagnosis of the nation's new reality on Wednesday. COVID is never going to disappear. Anyone who says we're going to eradicate it or that it's vanquished, honestly, they're lying, said Ranney, Associate Dean of Brown University's School of Public Health. COVID is going to be around forever. We have to learn how to deal with it, and we have to make it something that is no longer as dangerous as it has been. Biden faces a medical and political emergency. But Biden undoubtedly faces a political emergency since he is likely to be judged more than anything else on his handling of the pandemic and as his job approval ratings begin to erode ahead of the midterm election year. Biden's tetchy mood and buck passing during the Afghanistan crisis means he has an extra personal and political motive for establishing a new narrative of command over the pandemic. White House promises specific goals. Given these disconcerting new facts, it is incumbent on the president to refocus the nation's attention on the task ahead, to try to restore morale and to offer the kind of uncompromising truths that he promised as a candidate. Hospitals inundated. One group of Americans particularly keen to hear from Biden will be the physicians, nurses and health workers who've been at the epicenter of the disaster for more than a year and who are exhausted and, in many cases, increasingly despairing at people who refuse to get vaccinated. We're in a really tough place, Bashir said. North Carolina reported on Wednesday that it was recording a sharp increase in COVID-19 clusters among school sports teams, in another manifestation of the growing challenge to keeping in-person education on track. The accuracy of the data is being brought out by the experience of health workers on the front lines like Dr. Patricia Manning-Courtney, Chief of Staff at Cincinnati Children's Hospital. And that has completely changed, she said, adding a number of pediatric patients in Ohio were in ICUs and on ventilators. And while children with pre-existing conditions were most at risk, there are also some other children who are getting very ill. I can't promise any family that their child wouldn't get very ill if they happen to get COVID, Manning-Courtney said. The worsening plight of children was the latest, most alarming sign that the pandemic has entered a new phase. During the Afghanistan crisis, Biden described his job as making judgments others would not or could not make. He's facing another one of those fateful moments on the pandemic.
Thank you for watching. Please subscribe.